In part one of this video, I got through nausea, fatigue, and heartburn before my baby started crying. So now I'm back to do more pregnancy symptom tips. Headaches. Oh, this can be a really uncomfortable one. And guess what they're caused by? Pregnancy hormones. You might, have more sensitivity to light, noises, smells, certain foods. And two big factors in headaches during pregnancy are your blood sugar levels and how much rest you're getting. So, to help to ease the headaches, you definitely want to get more sleep for sure. You also want to drink more water. Practicing, relaxation methods like yoga, meditation, journaling, deep breathing, the classics, that can be really helpful. Getting prenatal massages every now and then can be amazing. And working with, pressure points right here, your temples, and giving yourself a jaw massage can be really, I feel so good. Giving yourself a jaw massage can be amazing. All right, next, this is one of my favorites and one that I pretty much constantly have, even if I'm not pregnant, TMI, constipation. So the hormone progesterone is relaxing your organs, your muscles, your ligaments around your pelvis, specifically your intestines, and it's making the contractions of the intestines slower. And this means that, fecal matter is typically spending more time in your intestines and it has more time to harden. And that's essentially what causes constipation. This hard fecal matter it's difficult for your intestines to move it through and out of the body. And if, the constipation gets too intense, you might develop hemorrhoids because you're having to push really, really hard to get the poop out. And so hemorrhoids can happen. And hemorrhoids, they're essentially small swollen veins in the rectum. There are a few things, luckily, we can safely do about constipation during pregnancy. The biggest one is eating more fiber. This helps to kind of fluff up the poop, making it easier to move through. Good sources of fiber. A great one is prunes, and I know a lot of people are like, ew, prunes, but I found a really great brand. They're called Looney Prune. They're based out of California. They're organic prunes. You can find the link in the descriptions and the show notes. Bananas, oranges, apples, mangoes, kale, spinach, beans, legumes like lentils and whole grain bread. If, that's just not working, you can ask your care provider if you can, take something like Metamucil or even just mixing psyllium husk into your smoothie, for example, and that all helps you get more fiber. Something else that can help to fluff up the poop, make it less hard, is drinking more water. So you want to drink a lot of water. I drink my body weight in ounces of water every day. So what that means is, say, if somebody, like I weigh 120 pounds, which I weigh more than that right now, but I still go by about 120 pounds. That's my normal weight. I drink 120 ounces of water. This might feel like a lot for you. Again, when I was at the end of my pregnancy, when I was like 175, that felt like a lot of ounces of water to drink. So I still did about 120, but we're wanting to drink a lot of water. It makes it easier if you have a nice big water bottle that you carry around everywhere. I provided a link to the water bottle that I love. It's a 40-ounce water bottle. It is like my third baby. It goes with me everywhere, and it makes it a lot easier to stay hydrated. If I had to keep track of how many glasses of water I drank during the day, I just wouldn't drink enough because I think I would overestimate. I'd be like, yeah, I drank plenty, but this water bottle is easy. I just have to do 3 of them, and that's, and it's not easy to do 3 of them, but it makes it easier to track. And also moving your body daily, even if you're just going on a walk around the block, can keep the poop moving. Next up is round ligament pain. So the deal with this thing, round ligament pain, is as your baby grows, your uterus expands and it kind of lifts up and out of your pelvis. And women, we have 2 round ligaments on each side of the uterus. And as these ligaments stretch to accommodate the growing uterus, they can cause, us to have stabbing pain, just like a jabbing pain. For me, it almost felt like strong, like menstrual cramps. And this occurs more commonly when we're, walking or exercising or we do a sudden movement, but it can also happen at any time. Of course, if you are concerned about the discomfort that you get from this, let your care provider know on the off chance that it's being caused by something else. But what typically helps round ligament pain is doing some yoga, stretching, working with a chiropractor who specializes in something called the Webster Technique. It can really help to manage round ligament pain. And while these options might work great for some women, of course, I have to say, check with your care provider before doing any new activity to make sure it's safe for your unique situation. All right, the next one was the very first pregnancy symptom I had. One of the most irritating, with the exception of nausea. So the night before I took a positive pregnancy test, I woke up drenched in sweat. And I was at my condo in Utah and it was about 10 degrees outside, but yet I was drenched. Come to find out I was pregnant, very exciting, but I continued to literally soak through my pajamas, my sheets every night. I would go to sleep with 2 or 3 extra pairs of pajamas and a clean sheet at the foot of my bed because inevitably I would have to change my pajamas, change the sheets. And it was so icky and a huge pain in the sheets. This is caused by an increase in estrogen. It increases the body's ability to cool itself through sweating. It's also caused by progesterone that increases the body temperature. A few things that you can do: you can use really breathable bedding. Some of my favorite is listed in the show notes in the description below. Drink lots and lots and lots and lots of water because you're losing a lot of fluids. You can also drink coconut water to replace your electrolytes that we lose. Like I said, have extra pajamas, extra sheets at the foot of your bed so you don't have to go take a shower every time you wake up drenched in sweat, or else you would be showering all night. Just have a quick change. You can keep baby wipes by the bed because even though we change our clothes, sometimes we just still feel kind of sticky from sweat. So the baby wipes allow you to clean the pits and all of the crevices, or even just wipe off your face and your neck. You can sleep with a fan. This isn't going to prevent the night sweats, but it can help keep you a little cooler. And strangely, this isn't strange, go to bed earlier, because the thing with night sweats is it's going to interrupt your sleep more. So say you normally go to bed at 10 and wake up at 6. With night sweats, usually if you feel great at 6, if you're up multiple times a night with night sweats, you're still going to be exhausted at 6 a.m. So go to bed earlier, and that can kind of help make up for the loss of sleep that you might have because of those night sweats. Okay, the last one is swelling, especially in the feet. I experienced something called pitted edema, and this means that when you press into the ankles, it's almost like you're pressing into Play-Doh, and that indentation stays in the ankle for a while. It eventually puffs back up, but it can be really uncomfortable. And of course, I do have to say that if you have really severe swelling, your skin is tight, alert your care provider, because that can be a sign of something like preeclampsia. So if it's super, super tight, super intense swelling, let your care provider know. But if it just, again, feels like your ankles have been injected with Play-Doh, or your face is just puffier, your rings suddenly don't fit on your fingers, that can be totally normal. It's just part of pregnancy. Again, let your care provider know if you're at all concerned. What to do about the swelling: eating more protein, drinking water, which I know sounds strange because we have the swelling because of water, but drinking more water actually helps to flush out some of the fluids that are causing the swelling. And you can talk to your doctor about taking a vitamin B6 supplement, which can also help with the swelling. For your feet specifically, elevate your feet as much as you can. That can help some of that excess fluid drain out. Get more foot massages, treat yourself. All right, and so finally I want to mention that the links that I provide to some of my favorite products for all of these pregnancy symptoms, they are affiliate links. They all go to Amazon. Because that's always where I get all my stuff, or not all of it, but a lot of it. I do, every time anybody uses the link and buys the product through that link, Amazon does send me, you know, a small bit of money, but it does not add any cost to you. And I only chose these products because they are the ones that I use. I wasn't trying to choose the most expensive or anything like that. These are products that I swear by and that saved me during pregnancy. All right, thank you for watching, listening. Please like, subscribe, because that's incredibly helpful. It keeps this whole thing going for me. And please comment with any questions you have. I answer them all.